we working on the hips right now. The first thing first, like I said, I'm look how clients lay down. I don't change anything. If you can see she's kind of like twisted this side way more. She lay down not in the middle. Her legs is kind of right in there, right? She don't put in the middle. So something going on, and it's telling me something not work properly. She's already correct this leg, you see? Before she was like that, I just tell her and her brain, they don't like this. They don't like, oh, someone tell me I'm not right, like, yeah, something wrong. And she start correcting that. You already guys know if she lay down, what we can check up here. We can check, see the hip, internal external rotation of the hip. You're gonna bring to 90 degrees and see it's not moving right. You lock it in, it have to be 35 degrees. It's not working, and they have to be 45 here. That's pretty good, right? An internal rotation. External rotation, sorry. Now I'm gonna check the ankle. This is kind of locked, and this one is, it's also, yes, I would probably work on this ankle. It's already telling me something, but like I said, today I'm gonna check the same with the left leg. Next one, I wanna correct the pubis symphysis right away. So most of the people, when we sit down, that pubis symphysis, it's slide in. Slide is not working properly. Let me grab that Mr. JB. Oh, actually, I brought the spine, so I have to cut this off. So this thing, if our hips is uneven, if we sit more one side, it starts sliding off, especially for the woman, because they have a childbirth and those sometimes ligaments is loosen up, and it's always not corrected, it's not balanced. So what I'm doing, my first move here, I want to correct that. So I bring to the 90 degrees, space, not much space up here, and I place my hands and I ask her to squeeze. You feel that pop? Mm-hmm. She just pop. So that's means that will slide back. And that sometimes causes a lot of pain, okay? So next one, yeah, so you just squeeze, and you kind of shake it. You see what you're doing here? You roll it, you lean out and back, in and back. You use your body weight, okay? Next one, you want to activate those glutes and see how strong she's on the glutes. You come up here. If you're a woman, so you're not gonna put your breast. So you come up here, you see 90 degrees, and you come up here and try to ask her to separate your legs now. And she's pretty good, she's strong. You see, I can feel it. So it's no problem. So what we find out, we have internal rotation of the hip problem. We have a little bit ankle problem. And this is what I'm gonna do right now. So bring to 90 degrees. My right arm is come right under this knee, right? You see this? Now, if you guys come up here, I'm gonna place my left arm on above the knee, just like that, and lock it in. You see, I'm lock it. You see what I did? It's wrestling. So I lock it in. Now what I'm doing, I want to push in, rotate, and pull. I want to push in, rotate, and in. If this is, I have to take this one away. If not, you can do this way, which is more harder. You hold it under your armpit. You see it? You come up here and you put on the top. And you push in and a little bit rotate it. Really gently. Does that feel okay?
Yes, it's a little bit cold.
Okay, so I'm pushed too much because I'm excited to do that. So I'm just hold it up here. Is that painful?
Just a little bit.
Okay, I push back. Is that painful?
No.
Okay, stay here.
That's for
hips. Yeah, you mobilize that hip. Look, and I'm gonna ask you to push inside. I'm just lock it in. She pushed this way.
Push this way?
Yeah, so you see she can do that. She can do that. She use only the, I want you to do this. Push inside. I just tell her, yeah, not right now. So I go back, now push inside. Yeah, you see what she's doing? Activate this one. And let it go. Very careful. Is there any knee pain? Do you feel any knee pain?
No.
Okay, good. So no knee pain, no nothing. Now I return to the back and see if I change anything. Did I do better? A little bit, right? Maybe 10, maybe like 2 degrees, but it's still good. So I can lean. Is that better now?
Yes.
Okay, so I can go deeper now. Okay. Okay, really good. So you guys want to practice? Come up here. Yeah, just do the same one. Yeah, bring to the 90 degrees and whatever you feel comfortable. Yeah.
Like this?
Yeah. And you get closer, yes. And you kind of lean with your body weights. If you, like I said, okay, you see you work so hard now. Watch me. So I'm come up here. You see I'm hold it and you see what I'm doing? I'm lean. Yeah, I know. I'm lean. I push body weight.
I didn't do push, you know.
That's okay. Yeah, yeah. Yeah, get closer. Get this close. And this one on the top. Just like that. And you lean.
The pressure is
Try the other way. Maybe you like other way. Come up here. This one is go under. No, under. Right in here. And this one is coming up here. And you grab here. Boom. Yeah, that's better, right? Easier. Okay. So yeah, it's a wrestling. If you you can put some sheets up here and you can lean with your body. So you kind of push in. You don't need to go cross midline. If the cross midline and the pain, that means something. You have a big problem with the sacroiliac torsion. Yeah, just like this. Stick and rotate, and you can pull. Watch how you're gonna do pull. Yes. So you see, you pull with your body. Yes. You pull with your body, and you just in and pull. That's how you mobilize that hip. Okay. A lot of people, I work on
Sorry.
So I work on this attachment, rectus femoris attachment, and this is kind of like a really delicate area. Usually I put the sheets and I rip it. So not to rip it, what's the call? Drape it, yes, so tight, and it's a bikini line. But if not, she's in the pants, I'm gonna tell her, so I'm gonna work on this area, okay? If you feel uncomfortable, let me know. But I need to work on this attachment, and it's sometimes really sensitive. So I come up here, yeah, and I find that spot, and I just do, it's a rectus femoris right now, right? So, and I'm just working on these muscles right in here. And it's really sensitive for some people. I can use one hand and another hand is come above the knee, and I'm doing this. So I do movements. And I feel this is right under my fingers. Yeah, really gently. So it's a goal, deep friction. Just start so far. And here we go, just like that. You feel that? You feel this area? Yeah. So, and now try just right here, and you just roll it. And yeah, just slightly like deep friction. Okay. Yeah. You can ask her to work with you. I'm gonna hold this, and you're gonna bring your leg like you're walking. So you're doing this. Here and all full extension. And you feel that pop? Yeah. So she complained of hip pain, and I can feel it now. And this is it. This is what I'm doing. I'm not work so hard, and it's actually really, really beneficial for her hip. Try it. You're gonna feel that. Right in here. Yeah. Yeah, you feel that? Ask her to breathe. She's not breathing. Perfect. Okay. Okay. All right. So now we going up. So we going up, and this is as we know, those PSOS muscles, those hip flexors, if they sit not like correctly, if they lean one side more than the other, so one side is more tighter, right? And it's pulling those hips. We already know how to measure. We find those anterior sacral. You see, she ticklish. That's mean the ticklishness. It's a type of pain, type of protection your body. So from the touch. Okay, I'm gonna be gentle. And you can see, yeah, this one is a little bit higher. That's mean this hip is high, right? So this area is gonna be really, really tense up. What I'm doing here, I'm always work on abdominal area. I don't know why massage therapists not work on abdominal area, but it's so many stuff going on here. This is digestion here. There's all these chakras here. This is have to be clean. So you want that energy go up and down. Okay. So what I'm doing here, I place my hands on no pregnancy. We can't do this to the pregnancy. Okay. If ask people if they have any digestion problem, if they have diarrhea. Okay, here we go. So yeah. So she's my go to the bathroom. So I place my two hands, and what I'm doing, I'm kind of like it's open book, and I put like a waves. See, and I feel it. Now I'm gonna find those ribs. I'm supposed to work on this side, but for the camera purpose, I'm gonna work on that side. And don't forget, we have this arteries coming up here. If you feel that pulsing, don't push because it's artery. So now I want to go under those ribs and I want to release that. So I feel the rib cage, so I'm going right on this rib cage under. So but she's good as she's on the with the t-shirt. You feel that? And she's just start taking a deep breath. And I'm just try to slide right in those rib cage. So I want to release the diaphragm. I want to work that breathing, because most of the problem, people not breathing right.
Is that psoas too?
Yeah, psoas is more how to find psoas. You find a navel and hip, and it's right between. So it's a midline. So I'm somewhere right in here, and you just apply a little bit of pressure, and now you ask her to, just flex her hips, and there we go. It's popped right on my fingers. This is how you feel. And now, without big angle, not perpendicular, not like 45, just completely flat, maybe like 5 degrees. Apply, and when she's breathe in, I don't do anything. When she's breathe out, I follow her and apply a little bit pressure. Okay, now she's breathing again. I'm not moving my fingers. She breathed against me, so I'm not moving. She's pushing against me. I'm not doing anything. She's working now. And when she's breathe out, I'm digging there more. And if you do this for like 20 minutes, you can really seriously like go all the way, even sometimes touch the spine. Right there. Yeah. And she's tied. I mean, she's really yeah. But now if I'm change the angle and I go this way, you see expression? It's too much. We don't need that. We don't want people tense up. We want people to relax and they feel comfortable. Like I said, we can't do this with a pregnancy woman, okay? I can rocking her a little bit, rocking. And she's out. Okay. Go under the rib cage again. Just open this up. Like we did this morning, exercise, breathing. We lay down and you feel it. You feel something like restriction. One side is twisted, right? So that's why you're massaging and it's releasing. I highly recommend every person in the morning before you get up, massage your stomach. If you sleep in one side, just think about you like side sleeper, you bring everything is tense up here. Now you try to get up and your spine is not balanced. And you know those jelly donuts? Yeah, so that can be serious injury. So massage your stomach in the morning.